Good morning and good afternoon, everyone, and welcome to the webinar, Women Leaders in Vaccinology Panel Discussion. I'm Dr. Kathleen Neuzil, and I'm a member of the Board of Directors for the National Foundation for Infectious Diseases, or NFID, and it is my pleasure to welcome you to this interactive panel discussion. We'll start with a few general reminders. Please note that today's webinar is being recorded, that all attendees will be placed on mute throughout the program. To hear audio, connect using your computer speakers. Select the question mark on the side of your screen to type your question. And at the end of the webinar, participants will be directed to an online evaluation. Now, NFID is a nonprofit organization dedicated to educating the public and healthcare professionals about the burden, causes, prevention, diagnosis, and treatment of infectious diseases across the lifespan. For nearly 50 years, NFID has developed targeted educational programs and outreach activities to raise awareness about infectious diseases and the importance of prevention and treatment. NFID is able to provide complimentary webinars through the generous support of many individuals. We hope that you will consider supporting our important work, and you see there the link at the bottom of the slide. Now, this panel discussion was initially scheduled as part of the NFID 2020 Annual Conference on Vaccinology Research. Unfortunately, as we have seen with many such events, this conference was canceled due to COVID-19. Now, we've heard a lot about social distancing, and I prefer the term physical distancing. We really believe at times like this, it's important to remain socially connected. And as you will see, the women that we chose to be on this panel are inspiring, and I think we are all in need of a little inspiration right now. So we are really pleased that NFID decided to go forward in sponsoring this educational content via webinar, and it is now my pleasure to begin the program. As I said at the beginning, my name is Dr. Kathleen Neuzil. I currently direct the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. I've worked on vaccine research and vaccine-preventable disease research my entire career at several medical centers and at PATH, which is a not-for-profit global health organization where I worked accelerating vaccine introduction in low-resource countries. And for me, a common theme throughout my career and in all of these stages along the way has been the guidance and support of fantastic mentors. And so I actually came to NFID leadership with this idea to sponsor a women's leadership panel, and it's now become an annual part of the NFID conference. So I'm really thrilled with the panelists who have agreed to be with us today. They are going to introduce themselves, and I will just introduce them briefly here. It's Emily Erbelding, who's Director of the Division of Microbiology and Infectious Diseases at the National Institute of Allergy and Infectious Diseases, NIH. Dr. Morita Griffin, Professor of Health Policy and Medicine at Vanderbilt University Medical Center. Julie Morita, the Executive Vice President of the Robert Wood Johnson Foundation. And Judy Stewart, Senior Vice President, U.S. Vaccines, GSK. And my sincere thanks to all of you for making time in your very busy schedules for this event. So Emily, we'll start with you.
So good afternoon. I'm just going to first confess that I don't think of myself as a vaccinologist per se. It's not really part of my identity, but I realize that very few people get a degree in that. I am a physician. I trained in internal medicine and in infectious diseases. And since I've come to NIH, which was first as Deputy Director of the Division of AIDS in 2010, I've had to dive really deeply into vaccine clinical trial design and even in earlier aspects of vaccine design in order to do my job. So I guess I've become a vaccinologist by on-the-job training. So I currently am director of the Division of Microbiology and Infectious Diseases, and we make vaccines to address gaps for any pathogen, including the ones that just emerge out of nowhere. That's what we're experiencing right now. And I really have had to immerse myself deeply in early discovery of vaccine and vaccine development all the way to planning for clinical trials to test them. So that's what I've been doing for the past 3.5 years.
Okay, thank you, Emily. Marie?
Yeah, hi. I'm also a general internist and without a subspecialty because I could never sort of focus in on one particular thing. Have been interested in everything. And I really thought I would end up practicing general internal medicine and not take this path into academic medicine. But after my training, I did EIS, which Epidemiology Intelligence Service at the CDC, which really changed my trajectory. And because I fell in love with epidemiology. And at the time when I trained, there was no talk about evidence-based medicine. And I felt like my training at the CDC introduced me to epidemiology really as a framework for thinking about how do we answer questions, how do we make decisions, both in public health and in clinical medicine. So after that, I went to Hopkins to get a master's in public health to learn more about epidemiology. And it's really my love of epidemiology that has driven me. And really the first 10 years of my career, I wasn't that interested in vaccines. And I got to Vanderbilt as an assistant professor and had some ideas about what I wanted to work on. And Bill Schaffner, who was in my chair, said, well, you can work on what you want when you get your own money to work on it. But right now we have money to work on vaccine safety. So why don't you do that? So yeah, so that's how I got into vaccines, but there was no turning back after that. And I'd say some of the most influential things for me was being able to serve on Institute of Medicine panels or ACIP and realize that that I could help inform policy. And that was a very exciting revelation. Actually, it was while I was serving on ACIP that I realized that we were actually making policy without much evidence. And that's what got me interested in studying influenza and trying to figure out what's the real burden of disease and how effective is the vaccine. And that's really driven a lot of the work I've done in the last 10 to 20 years. But I'll stop there and move on.
So thank you, Marie. And I was very fortunate to benefit from Marie's quest because that was one of my earliest projects as a Master of Public Health student was working with Marie on the burden of influenza. So one of the many wonderful women who have influenced my career. Julie? We can't hear you.
Good afternoon, everyone. It's a pleasure to be here. Thanks so much to NFID and to Kathy for inviting me to participate in this webinar. I am a general pediatrician. I'm currently the Executive Vice President at the Robert Wood Johnson Foundation. And I, like Emily, don't perceive myself as a vaccinologist and never did perceive myself as a vaccinologist, but did do a lot of vaccine work in a prior role. And I, like Kathy, also feel like my path has really been influenced heavily by some very strong, influential, passionate women throughout the course of my career. And I felt like I've benefited strongly from them, and they've actually helped direct my career to where I have landed right now. I am a general pediatrician, and like Marie, I did the Epidemic Intelligence Service after having worked in general pediatrics for 4 years. And in that time at CDC, really discovered and appreciation for population health. So while my training as a pediatrician was really focused heavily on prevention, I didn't really understand the benefit or the value of population health until I went to CDC and really got to experience the type of work that could actually influence large populations of people versus the individual patient that I was caring for when I was in practice. My career took a little bit of a turn when I completed EIS and decided to work to seek employment in the Chicago Department of Public Health, and reached out to the Public Health Department. At that time, it was pretty informal. I had reached out to a former EIS officer who was running infectious diseases in Chicago and asked him for a job. And he said, well, you can either do bioterrorism or you can do immunization programming work. And I said, as a general pediatrician, I will definitely take the immunization work. And over the course of the next 20 years, I remained at the Chicago Department of Public Health, majority of time doing immunization programming. And so where I'm at the other end of the spectrum from Emily, where she's developing vaccines, my role was primarily about making sure that populations in Chicago that were traditionally underserved and under-resourced were really actually able to access and benefit from the vaccines. Having the benefit of the Vaccines for Children program and many state health immunization or insurance programs, the vaccine was readily available, and yet we still had significant health disparities present in the city of Chicago. And so over the course of the 15 to 20 years that I was at the health department, I was actually able to work on a lot of programming to help address these immunization disparities. So it was mostly the programmatic type of work. And I think it was Marie who mentioned having an opportunity to serve on ACIP. I also had an opportunity to serve on ACIP, and I think I was among some of the earlier public health people who were included in that at the table, because in the past I think it had been a lot more academic and representatives, fewer public health folk, but had the opportunity to join the ACIP, represent local public health, and have our perspectives shared at the table. And I thought that was really a very educational experience, growing experience for me. And actually, it's where I first met Kathy Neuzil. Just last year, in middle of 2019, I made a career change and moved to the Robert Wood Johnson Foundation, where I'm focusing on helping build a culture of health, but really with the perspective of equity in mind and health equity in mind. And the work that I did in Chicago, working on immunizations, really helped to prepare me to do this work on a larger, broader scale.
I don't think we can hear Kathy.
I said, thank you, Julie. My phone was ringing. I had to mute myself quickly, but thank you. So thank you, Julie. That was perfect. Judy?
Well, I'm happy to hear that some of my panel members don't believe that they're vaccinologists, because that is definitely true of me. I'm probably a bit of an outlier on this panel in that I am not a physician. So I've spent the bulk of my career actually on the commercial side of the business. I have over 20 years of experience within the pharmaceutical industry, 18 of which is at GSK. And it hasn't all been in vaccines. So my career has spanned many commercial roles. So when I say that, I mean marketing and sales roles primarily, but for different therapeutic areas. So I've spent time in both vaccines, but also in diabetes and cardiovascular and autoimmune space. So my breadth comes probably from a bit of a different area than the rest of you in terms of therapeutic areas. I've loved kind of every minute of it. I do love being in vaccines right now. The idea of preventing a disease is much different than mitigating a symptom or trying to prolong disease progression. And so I do have a passion for this space. At GSK, I lead an organization that represents quite a bit of business. It's about $6 billion in business. Over 800 people are on the team, calling on physicians and healthcare workers every single day, with the exception of the last 2 weeks, to make sure that people are having access to vaccines, both pediatric and adult. And I've been reflecting on kind of what have my lessons learned been along my career, which is oftentimes you're moving so fast you don't have a chance to reflect. And I think probably the biggest lesson learned for me along my career journey has been just getting myself really comfortable being uncomfortable most of the time. So I don't know if we call that imposter syndrome or something else, but I've spent a large part of my career always thinking I'm doing something that I don't quite know how to do, and just learning to get comfortable in that space, no matter what the job is.
So thank you, Judy, which I guess is a good segue to COVID-19. I would say at this point, we are all vaccinologists, and there's probably not a time when we've all recognized the need and importance of vaccines more than right now. So I'm going to ask the audience, if you have questions, please type them in your box online, and we will field those questions. And while we're waiting for some audience questions, I'm going to start with the panelists, and I'm going to get the COVID-19 questions right out in front here. And I'm going to ask, and Judy, perhaps we'll start with you and go in the opposite direction this time, is how has your work, in terms of us all being in an uncomfortable position, pivoted right now in light of COVID-19? And what are you doing personally to stay sane during this crazy period?
Well, I should probably say I don't have that mastered yet. So I have ups and downs, probably like most people. I'll answer that probably two different ways. One, just personally what I'm doing. And then I can also answer it from a GSK perspective. So personally, we're all working at home and practicing social distancing and making sure that we're washing our hands and all of the things that the guidelines are telling us to do. So I'm experiencing all of that along with everyone else. But I also think part of what I'm doing, which this opportunity gave me a perfect opportunity to do, which is put makeup on and put my clothes on and look like a human being every day. So that's been just having that routine and not breaking the routine that I would normally have if I was in the office has been really helpful. I think also getting out, for me, fresh air is really important. So getting out of my house and going for a walk. I live in the city, so I can, walk the streets without really bumping into anyone right now. That's also been really good for me, and connecting. I mean, the silver lining in all of this is that I'm able to talk to my family, my mom and my dad, and check in on them probably more than I would if I were in the office working every day. So that's been probably a positive of all of this, and looking for those positive things I think is also important. From a GSK perspective, obviously we are working very hard to help and partner with companies. We have two partnerships right now, one with CEPI and one with Clover Pharmaceuticals, and obviously talking to others about what we can do specifically around our adjuvant system. So we've got an adjuvant system that can help boost the impact of an antigen, and during a pandemic, obviously having something that can help spare antigen levels is important. And so we're looking to partner with people and help out however we can there. I think the other thing that we're really focused on, and have to thank a whole lot of people, is just making sure that the essential workers who are helping get our medicines and our vaccines out to the public during this time is super important. And so they've been working around the clock to do that. So we've got kind of a mixed group. We've got people that are working from home and practicing social distancing, and people that are still going into the labs and into the manufacturing sites to make sure that we still have access to medicines. So that was a long-winded answer to your question, but
that's okay.
It's a good one.
Okay, thank you. Marie, any comments?
Sure. Well, in Nashville, our Metro Director of Health started his new job 2 weeks ago. So obviously he's drinking from a fire hose. And so we are really trying to gather up resources to help our public health colleagues. And it's been great to see how that's come together. And I think that's also sort of quells anxiety if you feel like you can contribute in some way. And also, we really want some decisions to be data-driven and based on local and regional data. We're all really interested in having that ability to help make that happen. So we're trying to help the health departments get the platforms up that everybody can see what is happening in our region. Personally, I am running and playing tennis, and if the rain ever stops, we'll be able to get outside more, but yeah.
Okay, Julie? Would you like to go next?
Sure. So as a former health commissioner of Chicago who had experienced H1N1 pandemic and numerous vaccine shortages in the past, it's really, really hard for me not to be actively involved in the response that's happening in Chicago. And so I've been sitting on the sidelines rooting on and cheering on my former colleagues who are back in the health department, which I think is helpful for me, at least to feel like I'm somewhat engaged with them and offering my support through this process. From an RWJF perspective, we are annually, we grant out about $500 million every year to support efforts to build a culture of health, which is really focused on meeting the needs, health and healthcare needs outside of just healthcare delivery. And so what we have been doing over the past few weeks is really looking at our grant making, what we're planning to do for 2020, and seeing how we can reconsider or refocus that grant making so that we can actually help to support some of the response and recovery activities that are happening in the US right now. I think in general, with these kinds of crises, what happens is that there is a huge outpouring of funding to support response activities and less available for the recovery type of activities. And so we're at this point looking at what are the needs, understanding what resources will be coming available from a federal perspective, because there are billions of dollars that will be coming available. Where are those resources going? And then what gaps can we fill, particularly with an eye for the underserved and under-resourced communities who often get overlooked or missed in these type of situations. What I'm really thrilled about too is that Rich Besser, who is our president and CEO, was a former CDC director and has been very, very aggressive about being in the public to lift up the concept of equity as we look at the responses and the allocation of resources that are occurring to respond to coronavirus. Because I think we know at baseline and in peace times, we have these communities that are under-resourced, people of color, people living with disabilities, indigenous populations. Those groups are underserved and under-resourced at baseline, and in these times of emergency or in crisis, they are often neglected as well. So really making sure that work that's happening really acknowledges their needs, and also we're looking at the ways that we can make sure our resources are filling in gaps to meet their needs. From a personal perspective, fortunately, I live near Lake Michigan, and I'm able to take long runs and long walks along Lake Michigan, which is very soothing and helpful for me. But the other thing that I do, which I think is fantastic, has been made me more aware of and appreciative of, is online yoga. You can find incredible online yoga for free, and I have found that to be incredibly helpful and relaxing and rejuvenating.
Thank you, Julie. Emily?
Yeah, so professionally, we have about 300 pathogens in my division of microbiology and infectious diseases that we're responsible for. And when this outbreak first emerged, it seemed like we tried to keep everything else going, but I have to admit, in the past 2 weeks, pretty much 99% of my time is spent with staff that's directly working on a coordinated response to COVID-19. Largely, a lot of the efforts are vaccine related, although therapeutics and clinical trials related to therapeutics, developing new therapeutics, supporting development of diagnostics, all of that is also in the mix. We were really happy to launch a clinical trial with a vaccine last week with the person getting immunized, first volunteer in Seattle. But now we just have to keep pushing to get products into efficacy trials, because I don't see this situation being remedied any other way other than a vaccine, getting to implementation. And of course, that's going to be very hard work, and we're probably going to need more than several to get to that point. So it's all consuming right now. What do I do to stay sane? I've always been big with exercise. I'm a runner, I'm a rower. It's not rowing season, but I can still run because most of the time it's not raining here. So Maryland orders for social distancing haven't restricted just being outside and walking about yet. So I run on a trail near my house, and I get workouts from my personal trainer that I can do at home. So I'm trying to stay fit through it all.
So everybody may remember over Christmas, there was that commercial about the Peloton bike, right? That everybody was laughing about. And so when my husband bought me a Peloton bike for Christmas, I had a lot of teasing. Nobody is teasing me now because that Peloton bike is being put to good use during this pandemic when the gyms are closed and I don't have Lake Michigan. But in all seriousness, I think that this panel illustrates, and this is what pandemics do, that everybody is affected at every level. You know, every one of us is affected at a personal level, at a professional level, in multiple ways. And globally, you know, I sit on the World Health Organization SAGE committee, which is the advisory committee for vaccines. You know, it's really overwhelming to think that any immunization services would be disrupted in these low resource countries because of COVID-19. And yet we know it's going to happen. And, you know, they're living on the brink of polio and measles exploding. And so it is an overwhelming situation. And I think the bright spot has been seeing how everybody is willing to work overtime, pitch in, and approach this in a group manner. So looking at some of the questions, you know, we've all talked about the mentors that we have. Any practical advice from any of you, and maybe you can just raise your hand if you'd like to go first, on, you know, how people might identify a mentor? You know, what's your philosophy of mentorship? Is it one person? Is it many people? Just what is some practical advice that you could give young people, mid-career people about mentorship? Julie?
I'll go ahead. So I've made a couple different pivots in my career, from being a general pediatrician to public health, and then now into philanthropy. And I think that at each point that I made a pivot, I was in that uncharted, uncomfortable space that Judy talked about, where I felt like I was an imposter. And I think what was often comforting or helpful to me was finding people who were well established, who had been in the field, and they didn't necessarily have to be the executive director or the leader of the organization, but people who were well established and comfortable in their field, and just watching, listening, and learning from them to hear how they approached their work, and then taking parts of their approaches and incorporating them to my own approaches is what I have done over the past few years. But I had great benefit to work with a wonderful general pediatrician in my first practice. I had the great opportunity to work with Cindy Whitney and Ann Schuckett when I was at CDC. And I've joined the Robert Wood Johnson Foundation, where Lavisa Murray, who is our former CEO, had paved the way for a lot of fantastic work. And so there have just been incredible women, not always the CEOs, but definitely strong leaders that I was able to learn from. And I don't know that any of them would have considered them my formal mentor, but they're just people that I watched and observed and learned from.
Marie?
Yeah, I think one of the things I mentioned earlier was that I was asked to work in an area that I wasn't particularly interested in. And I thought that was, at the time, it was good for me because I was learning from people who knew what they were doing. And I feel like, especially early in people's career, sometimes there's a real desire to, you know, do what you want to do and find the mentors that are going to help you do what you want. And, you know, the mentors that are already funded and are already doing things are funded for a reason, because they're probably doing things that other people think are valuable and are willing to fund. So I feel that relationship, when somebody comes to me and wants to work with me, wants to do what I'm trying to do, it's great for them because they're getting a lot of support because it's things that I need to get done. And it's great for me because someone who's getting a mentee who's enthusiastic usually discovers new things and enhances what I'm able to do. So I think it's good to look for people who, when you're young, who are doing something you think is interesting, and try to help them do a job rather than carve out your own space immediately.
Good advice. Emily?
Yeah, so with regard to mentorship, when I was a fellow, it almost seemed like, I mean, I'm not going to say a burdensome thing to come up with the perfect mentor that I was going to do my fellowship research with, but it was definitely something that you constantly heard about as a choice that would be, that your career would be made or break. It was a make or break decision for you. And I think that I came over time to appreciate various people and to adopt through the course of my career aspects, sort of in the way that Julie described, of the ways that people did things. Some people, as I moved forward and became a supervisor, some people were good at motivating a team and getting them to be productive. And so I tried to observe them and plan and learn from them in that. Other people had, there were people that were very good at thinking through research problems, and I tried to get advice from them when it was fitting. But one specific mentor throughout my career lifetime, that isn't how my career has progressed, but I've learned immensely from various aspects of people in different situations. So I think it's good to think that way, be open to new things that are coming along, and if you feel uncomfortable, look at how somebody else is handling the situation and that's mentorship too.
And even though you are all at the top of your field, I'm also hearing you talk in the present tense as well, in that we always have mentors, we always have people we learn from. Emily, you make a really great point. Depending on what area it is, we can always learn, even if we're in a position to be mentoring others. Anything to add, Judy?
Yeah, I mean, I think a couple of thoughts. So, in a corporate setting, having mentorship where there is, quite a bit of hierarchy is almost becomes critical. And so I've been really fortunate across my career to have different mentors, many of which are women, honestly, who either were in positions I might want to try out at some point in my career, or to others' earlier points, just were really good at something that I was trying to get good at, and I was trying to learn by being close to them. But I think all of the mentors that I've had that I've learned the most from are people that I genuinely really enjoyed their company and being around. There was a very natural connection, and I enjoyed talking to them, to speak honestly to them. I tell a lot of people I've usually always had at least one mentor in the company that I was working in, and one mentor purposely external to the company that I was working in, or the teams that I was working around. And I did that purposely because I wanted to make sure that I always had a sounding board or someone that I could go to check in with, where I didn't have to be worried about the politics of the organization, or that that would be shared or seen differently by someone who was a manager or a supervisor. And I think that's maybe another way of looking at mentorship. It doesn't always have to be in the place that you're spending your day to day. It could be a friend, a colleague that you used to work with, or someone that you just admire as part of your private network.
Yeah, thank you, Judy. So we do have an audience question, and it's a hard one. So I'll read it slowly to give the panelists a little time to absorb it. So are there career decisions that you may make differently if you were to think back or do them over again?
I can take a stab at that if you want. There are definitely choices that I made early in my career that if I had all the hindsight, I probably wouldn't have made. However, I don't subscribe to necessarily regretting career choices, because you learn a lot from each one of those. And some of the jobs that I enjoyed the least, and I've had a few of those, I took a stint, based on a mentor's advice, I took a stint in human resources, which is very different from sales and marketing. And I learned more about people and the organization of people than I could have ever done in any other job. I recognized that functional area probably wasn't the most exciting and passionate for me. So I learned kind of what I don't like about jobs, but I did learn a lot. So my personal opinion is I don't think I would do anything over, because I I wouldn't have learned what I know now.
Anybody else? Marie?
Yeah, I think I'm one of those people who don't want to promise what I can't deliver. And so sometimes I think it keeps me from doing things that would expand my opportunities. So my husband and I took a sabbatical and went to the West Coast for a year. And I really limited what I did for that year professionally because we had 2 children. I knew I had to put them into school. And I really felt like, in retrospect, I could have done a lot more and could have learned a lot more from people at Stanford where we were. And I really probably didn't put enough effort into creating a good working situation for myself because I was fearful that I wouldn't be able to handle the other part of my life. And I think when I talk to younger women or people now, I think that's a characteristic that a lot of, I mean, maybe men and women, but it's more likely to be something that women do. They don't want to overpromise. And so sometimes they limit what they do. And I think, you have to be careful about doing that. And as it turned out, both my kids, were in school and they were saying, why are you picking me up from after school so early? And I wanted, we're fine. I mean, they did not need me at all. So I had plenty of times to run in the woods, which was great. And I got a lot done on my own, but I could have done a lot more, I think.
Okay. Anybody else?
Well, I can say something. So I think in various points in my life, I, like Marie, would not want to commit to something that I didn't know that I could do. And yet there were several times where I actually went ahead and tried it, whether it was accepting the position as commissioner, because when they offered me the position as being the health commissioner for Chicago, I really loved what I was doing in immunizations and wasn't sure that I really wanted to make that change. But I thought, oh, I'll just give it a try. And so I think and I'm really glad that I did it because I really love doing it. And I learned so much and I grew so much and I never regretted doing it. But I always in my mind had the thought that I'll give it a try, but if it doesn't work out, if I'm really not happy, I'm going to give myself an out and I'll look for something else. So I never felt like whatever I was committing myself to was forever. And it's kind of like this change with me for philanthropy as well, is that it's a big change to go from government public health to philanthropy. And it's been a steep learning curve. I'm 9 months into my new job and it was a big decision and I really struggled with whether it was the right thing to do. And but I also thought to myself, I can find another job if I'm not happy here. So I'll give myself that out, that I'll give it a chance, accept the challenge and see what happens. But I also am fortunate that I have a very strong support system in terms of a spouse who is available and supportive of me experimenting, other family members who are supportive, children who are young adults who are supportive as well. So it's at the right times you can take those kinds of chances and push yourself a little bit, but always know that having an out makes it easier to kind of accept a challenge like that and see if it turns out or not.
Okay. Any other comments on that? I mean, there are a lot of themes too about change and transition and whether we intentionally change or take the next step or change happens as we're having to adapt to a huge uncertainty right now. It really is a quality that we see in leaders and successful people, which leads to the next question, which is also a very good audience question, which is, it would be great to hear what qualities you have felt made you effective, or when you looked at leaders in your field at a young or mid-level. You've all said you had great mentors. What were the qualities that make you say that was a great mentor? What qualities do those people have?
So the people I've always admired, whether they're mentors or just other leaders, or even very early in your career, I think you can see kind of the people that have just an innate curiosity for things, no matter what area it is, tend to be the individuals that reach out. They are curious about what others are doing. So they build networks very, very organically. They're also very curious about how the business runs, how the organization runs. And so they're constantly asking questions and learning. And I think that is a quality that serves you well no matter what area of the industry you're in. And it also, I think, has the byproduct of getting you a network, getting you in touch with people, learning about other opportunities that you might have, just because you're simply curious and asking questions. And so I think that's one that I look for in individuals when I'm hiring, but I also think also are what I look for when I'm admiring people.
Great, thank you. Anybody else? Emily?
So I think the question, what is a good mentor? I mean, I think personally, when somebody gives you an opportunity or suggests that you take on this project and then understands what unique attributes you have that are going to make you successful at that project, that always made me feel a little bit more comfortable in taking on something that I wasn't, that I maybe wouldn't have thought of on my own. But I think as I go through, you know, meet new people, I think, yeah, they're curious. Yeah, they ask you questions, but if they specifically get you, or in the case of somebody that's being mentored, you specifically know what that person's skills are that they could that could grow and apply to this circumstance or this challenge or this new project. I mean, I think that's one thing that makes somebody a successful mentor. It's sort of finding the right match people to project and supporting that so it's successful.
Yeah, thank you. Marie, I thought I saw your hand up.
Yeah, I think that that's really, I've been a trailing spouse a number of times. And, you know, I think what's been really important about that is that the two major big changes I made, the mentors were very enthusiastic about having me, even though I wasn't the primary recruit. And so that really helped assure my success, because I had people that had my back and were interested in me. And so obviously I wouldn't have trailed if I couldn't have found a good place. But I think it is a challenge. I think also, whether it's a mentor or a colleague, I think, you know, life is short, and it really, you know, you want to, I think there are lots of great people out there. I love the curiosity thing that Judy said as well. And I think I've always just tried to work with people I really like personally and professionally. And it's really not worth it to work with, even if somebody is very successful. There's just plenty of great people around to work with that make your life enjoyable. And so I think that's what I've always tried to work with. Really people I like, and that they're curious, and they also are responsive. Like they get the job done. They're willing to put the work in, whether they're the mentor or the mentee. That's really important.
Yeah, thank you. Anything else from anyone?
I think the three characteristics that I have find is common among the people that I have been drawn to as mentors are that they're typically people who have a clear vision of what it is they want to do or what's a priority for them. They're critical thinkers, and they really think critically about all the work that they're doing, and maybe their lives as well. And that they're also good listeners, because I think it gets to what Emily was talking about in terms of really understanding who they're working with, what they're doing, why they're doing it, and really absorbing it. It's not just about what they envision, but they have a vision, but they can incorporate what they're hearing and seeing around them. So those would be the characteristics I seek for people who are that I want to inspire me.
And we're getting near the end. We still have a little bit of time, but I don't want us to get too close to the end without asking you if any of you have advice that you would like to share with somebody starting out in the field or generically any field. You know, we have a diverse audience on this call today. And again, what advice? You are all in senior positions. You are all highly successful and respected in your field. What advice do you give to somebody that's starting out?
So
Emily?
I'll say, don't be afraid to fail. So don't hold back yourself. And I think, I went to medical school, and, during medical school and internship, you check and double check every, potassium result that somebody, that's sort of the mentality or the work ethic. And that doesn't necessarily, when you progress through that training and then have to step out into a career, maybe in academic medicine, maybe in research, you weren't necessarily prepared to take risks yet. I think that's what you need to do sometimes in order to stretch and in order to push ahead and to do into advanced discovery, which is in the world that I live in now, we look for. So don't be afraid, don't hold back, stretch yourself, go for it. That would be my advice.
Thank you. Anybody else?
So I got some advice from when I first became commissioner of the health department from Jonathan Fielding, who was a longtime health commissioner in Los Angeles. And one of the things that he said was that treat the job like you don't need it, because then you'll always do the right thing. And so in government positions where they're often political in nature, I felt like that was something I really held with me for the 4 years that I was commissioner, where I felt like if there were political pressures on me to do something, I didn't think about that pressure as much as what is the right thing to do in this situation. And I don't really need this job because I'm going to do what's right. And if they don't like me and they boot me out of this position, it's okay because I was doing the right thing. And I think it applies to other non-political jobs as well, where you are put in positions sometimes and asked to do things. But if you are clear in your mind what is the right thing to do, that you'll generally end up in the right place. And it does take a little bit of risk because you might lose promotion, you might lose a job. But if you're still doing the right thing, you have to live with yourself at the end of the day. And so I think that was something I found to be very helpful.
Yeah, great advice. Thank you.
From my experience, I think the advice I would give to someone very early in their career is be open to any and every possible experience you can have. I wouldn't limit yourself or see yourself as a subject matter expert in any one area when you're first starting your career. I think getting as many different experiences as you can, you might surprise yourself and wind up going into an area that you didn't think you would enjoy or like. I think I also recommend when you're younger in your career, if you have the ability personally to do it, get global experience, whether it's a project and a short-term opportunity or going and living in another country and working. I think having a broader view of the world is important, especially when we talk about public health. I think also figuring out how to get a mentor pretty early on would be helpful because they can help you navigate the company or the organization or the group that you're working in. And so those would be my probably tips and tricks.
Yeah.
Okay.
I direct the MPH program at Vanderbilt, and I often see fellows who are interested in MPH but are worried that their families think it's time for them to really settle down, and when are they going to get to the end of more school or more training. And I think it's I would say sort of like Judy, get more even if you're still doing training and you're extending your training, people are getting paid at that point. They're still doing work. They're still doing valuable things. And there's really no there. I mean, I think it really is worth it to get the training, additional training to increase your opportunities, because you don't want to end up just doing the same thing for 30 or 40 years. And that I think doing a lot of different things when you're young and being able to expand your opportunities makes a lot of sense.
Yeah, I would agree. I mean, if you listen to everyone on this panel, everybody's made, some changes in their career. And is there anyone, maybe we can do a show of hands, that's doing right now what they thought they would be doing when they graduated from medical school or from, you know, graduate school or business school. Any of you. I certainly am not doing what I envisioned I would be doing. So maybe based on what you said about the past, so now looking forward, and again, I think it's a continuum, you know, is there anything you would predict in the next 5 or 10 years, or looking at the field and whether, you know, we're all in vaccinology in some way, it could be public health, broadly the field. Is there anything you think people should prepare for? You know, what should they be thinking about now going forward? How is the world going to change in the next 5 to 10 years? And we want people to be ready for it. Any thoughts there?
Well, I think this is a great time for it to be in the vaccine area because there are so many new exciting developments and especially, I mean, for pediatricians, they're used to valuing vaccines, but for those of us in adult medicine, you know, it's taken a long time for vaccines to get respect. And so I think it's, there are great opportunities out there.
Yeah, it's
Anybody
possible.
else?
I mean, this is a terrible epidemic that we're experiencing, and I don't know how long it's going to last, but it's possible that if vaccines visibly address and reverse the consequences of COVID-19, there will be a renewed faith from the public in you know, the basic immunization schedule all the way through. So that's a hopeful statement, obviously, but I think that it's possible.
Yeah, and I think if you think about this trajectory, there's lots of things we can do, but obviously the game changer is to prevent the disease, and certainly on a population basis, vaccines would be the best way to do that. Any comments for others? Anything practical? Like, I wish I was better at, you know, computers, and all the young people are better. Anything practical that, you know, you wish you were good at, or?
So I'll just bite off of that comment because I do think what I see, at least from the commercialization of medicines and vaccines, we definitely have already seen a trend. You'll continue to see it in the next 5 to 10 years, an acceleration of digital activity, you know, using your computer, teledoc is an example that you're hearing a lot on the news now. I think the way that patients interact with healthcare, whether that's through their physician or through a pharmacy or through, you know, an organization or a system, I believe that will become a much more digital interaction than even we're seeing today. And so I do think that's probably a skill set and a capability that couldn't hurt any of us to improve.
Well, and can anybody believe, I mean, how many Zoom calls have people been on in the last 2 weeks? I've never been on so many Zoom calls in my life. Is what we're having, how we're having to rely on technology right now.
Well, and you know what else? I mean, we've all talked about the fact that, you know, I grew up in a world where the idea that you weren't working hard unless you showed up at the office for a certain number of hours, that's gone out the window, you know, with this, you know, with this whole, I mean, it's been an evolution, but I think with this experience that we all have, we're realizing we can be just as productive working remotely. It just requires a different muscle and a different way of connecting, but it's not impossible.
Yeah, I think building on that there's opportunity to, if there is a coronavirus vaccine, that there'll be lessons that we learn from that and systems that we adopt that hopefully will be able to be applied moving forward. I just think back about H1N1 and the 2008, 2009, and at that time, we weren't really using pharmacies that much to administer vaccines. But at that point, because of the need, we really pushed the flu vaccine into those pharmacies and asked them to step up and really play a more major role. So I'm hoping that with this coronavirus, if we get a vaccine, that we'll come up with some novel delivery methods that really help us to get the vaccine into those who need it broadly and widely and quickly. Because I think there were some good lessons that were learned and practices we adopted through 2009, 2008, or 2009, 2010. And I'm hoping that we'll take some lessons learned from this experience and move them forward.
Good. Emily, were you starting to say something or no? You moved maybe, and I get this
Just
green
right.
light around. So we're getting very close to the end of the hour. Any last comments from anyone? Okay, I just really want to thank the panelists. I think this worked out really well. I know I was a little bit nervous. They all saw me in the practice session, and I couldn't quite figure all this out. And in the end, I thank you very much. I thank you for your time. You are all inspirational, and I have made some new colleagues through this effort. Judy, you know, we hadn't met before, and we talk about the importance of mentoring, and you know, Julie and Emily and Marie, of course, we've have and currently still have, you know, a number of interactions that I really value. So thanks to each of you. And for the audience, thank you for joining us for this panel discussion. This webinar will be available on demand at www.nfid.org/webinars. We really thank you for attending, and have a safe and healthy day.
Bye, everybody.
Bye.
Bye.
Bye.